Acne is a very common disease. It's found in 70% of teenagers. So they all suffer. Some patients have it very mild, others moderate, and some are severe. Fortunately, the majority have it from mild to moderate acne, and a minority have it severe. Acne can start as early as 8 years of age, and it can go on into your 30s. And why? Number one, it is inherited. It's a genetic disease. If your parents have acne, had acne, then there's a very good chance you will also have acne. Our diet plays a big role in acne. Our hormones play a big role in acne. The birth control pills that young women and middle-aged women are on, if it's the wrong dose of hormones, can precipitate acne. The injectable hormones, the implanons, the IUDs, all can cause acne to flare, and also in patients who have never had acne, now all of a sudden they're breaking out because they have hormone shifts, hormone changes. The other thing is, freshmen, when they go to college, they gain the 5 to 10 pounds. That little bit of weight gain can give acne eruptions in girls or young men who've never had it, just a weight gain. Or working out like crazy and ingesting a lot of whey protein, as young men will do, to try and get muscle mass. Whey protein, hormone changes, weight gain, diet, high carb, high glycemic diet is bad for acne. So off you go to college and all you eat is pasta and pizza because that's all you have. Macaroni and cheese, it's just delicious. But that weight gain and that high glycemic diet does precipitate acne and make it worse. So there's also a disease called rosacea, which is looks like acne in the middle of the face, fine little pustules and bumps. That is a rosy red eruption called rosacea. So don't confuse rosacea with acne. Those are two different diseases. Acne, if it's in a female and it's hormonal and we feel it's severe enough, we will start birth control pills with the recommendations also of OBGYNs. We will start systemic treatments. Sometimes we use antibiotics. We also use laser treatments. We use extractions, topical chemical peels. So there are different modalities depending on what kind of acne you have. So topicals are used for blackheads, retinoids, epiduos, things like that, to soften the blackheads, get them out. We use topical antibiotics, topical anti-inflammatories, and then we use orals. So orals, antibiotics, hormone suppressors, hormone blockers, birth control pills. There are numerous medications we use prior to trying to get you onto something called Accutane. Accutane is a high-dose vitamin A. And if you're severe enough or unresponsive to treatments that we try for months, then the only option we have really that is very, very effective is used Accutane, which there are many names for it. There's Absorica, there's Amnesteem, but it's all an Accutane, a high-dose vitamin A derivative. How does that work? It shuts off the inflammation, the inflammatory responses that acne has. It settles down the pores, shuts them down, shuts the oil gland down, it dries things up. And after 5 months, 80 to 90% of patients are cured, especially young men. Those are cured and the acne never comes back. However, in females, because a lot of it is a hormonal response, they must maintain either a birth control pill or something called spironolactone, which is a male hormone receptor blocker in the skin. That must be maintained. So we have lots of different options for acne. You have to do your part. Watch the diet, watch the weight, watch the hormones, and then we can do our part to clear you effectively and long-term and safely. So we'll see you at Trillium Creek if you have any acne issues, any rosacea issues, and we'll get you the best treatment. Thank you.